Hi everyone, this is Sean with the MassSupport Network, here with your COVID-19 update for Friday, February 19th, 2021. Things continue on downward trend. It's been 2 weeks since we last checked in, so we'll look at the data from 2 weeks. 5.6 million new cases of COVID-19 over the last 2 weeks, 1.2 of those here in the United States. That's actually pretty good news because last week of January, 1.2 million is how much we saw in a single week. So things have dropped dramatically and are continuing to drop. Here in Massachusetts, the weekly average was 15,000 new cases per week of the last 2 weeks. Deaths are going a little bit more slowly to trend downwards, with 160,000 deaths in the last 2 weeks. Worldwide, 37,000 here in the United States, and 902 people died from COVID-19 in Massachusetts in the last 2 weeks. Looking at these trends graphically, you can see that everything is in almost free fall at this point, although some data in the last couple of days should be taken with a grain of salt, as storm disruptions, especially in Texas, are throwing off a lot of the numbers there. And hopefully tests is one of those, because those are starting to get a little worrisome as how they're trending downwards. This is how the daily tests have gone, and those have trended downwards. It's pretty much as the same pattern as cases have from those peaks in the first week of January. Now, hopefully those will rebound. A lot of it's probably because the same people who are administering tests are now administering vaccines. And one could make the case that as cases drop, we actually need less testing because fewer people are feeling symptoms and thus asking for tests. But we still need a large number of screening tests. We really want to make sure we're not going to see a resurgence, especially with the new variants. But looking at the country in terms of new cases, comparing the first full week of January there with this past week, you can just see from the left to the right there how much things have dropped off. Now, these are all still, in many places, very large numbers, over 60,000 cases in California, Texas, and New York. But when you compare those to where these things stood basically a month ago, it's astonishing how far they've come down. New York is seeing half as much, as is Florida, Texas, even about a third as much, and California, that's maybe 20% of where they were seeing at the beginning of January. So things have really dropped off just about everywhere. So that is very encouraging. There's the progress we're making, even if we are not yet quite in a good place. That looking at hospitalizations, that continues to trend downward. This is one of the, this graph comes from the CDC's new weekly report, which has a lot more numbers on this one. You can see that there's been a 21.8% decline in the 7-day average, which is pretty good. This is going to drop a little bit slower than cases, of course, because just the way that hospitalizations lag. But looking at where hospitalizations are by state, things are generally falling down. New York is the one place that is still seeing a pretty high amount of hospitalizations per million people, but all those other places like Arizona that were previously very high have come down a lot too. So that is pulling a lot of pressure off our healthcare system. Deaths as well are trending down. We are now, we crossed below an average of 2,000 deaths per day for the first time since December 4th. And as recently as 2 weeks ago, it was over 3,000. So that's dropped off significantly. Now, I think it should go without saying that 2,000 people dying a day is still not good, but that is, that is 2 months of progress there. So that at least is something to be happy about. And also, we are starting to see the impact of the vaccine in our older populations. Since long-term care facilities were one of the first places to receive the vaccine, this graph shows since September what percentage of weekly COVID deaths came from long-term care facilities. And it was more or less even for most of the fall and winter. And then in January, it starts to drop off steadily there. So there's not that is what we're seeing is that the increase in vaccination in that population is preventing deaths there, which is the goal. So that is great news. And if we should see this continuing to decline in the coming weeks, that'll just kind of show what the vaccine is really doing as we sort of our first evidence of the vaccine at work. We'll talk quickly about developments. First of all, a major storm system that's hitting the country west to east, especially Texas, is slowing vaccinations, testing, everything. Data reporting is going to be off. Testing is going to be slowed. Vaccinations are going to be slowed, and we're starting to get a little bit of it here as well. Not as much for us in the Northeast as it seems, or at least we're more used to it than they are. But we should expect a slight slowdown in the pace of vaccinations, at least. Also, it kind of comes at an unfortunate time because the second part of phase 2 in Massachusetts started yesterday with people eligible who are 65 years old or older, or people who have 2 or more underlying health conditions such as COPD, diabetes, and others. So that is a much broader population than we've had eligible before, and that did strain the website for a while there as many more people bring in, and that kind of is perhaps a preview of what is likely to happen when phase 3 finally starts and people of all ages, professions and health conditions are able to sign up. So hopefully that we'll have our web infrastructure a little bit more robust by that time. So you can find our sources at the COVID Tracking Project, New York Times, mass.gov, and the CDC's weekly report. And for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.